give you the pen, but I can't do that anymore. So
Take a rain check.
with that, Pete, I want you to say a few words.
As you can imagine, I have many mixed emotions today. They go back and forth between happiness and sadness. I am honored to be here as Governor Baker's guest, as are my parents, Sam and Nancy DeMarco. They loved Laura like a daughter. And Amber Levis, our niece, who's up from New York City today to join us, and will be coming to Harvard this fall. I'm proud of you. Governor, I am so grateful to you for making Laura's Law an actual law today. For so long we've been talking about it as just a bill. I'm grateful that every single member of the state legislature, from the Senate President to the Speaker of the House, the old one and the new one, from majority to minority leaders, they all supported Laura's Law in spite of all the hurdles that coronavirus has handed us. It took nearly 2 years to get here. I wasn't sure we'd even reach this day. But in the end, Laura's Law passed unanimously. In the end, everyone saw how good and pure a bill this is, how essential it is, and how extremely important it was to honor the life of a young, beautiful woman who died so tragically and so unnecessarily. Laura could have been any one of us. And now, because of Laura's Law, every one of us will be helped. And for some, maybe even their lives will be saved. I hope very much that when the pandemic is over and standards for signage, for lighting, for security monitoring of doors at every emergency room, when those standards are implemented, that Massachusetts will lead the country in taking the worry out of whether you'll be able to find and get inside an emergency room when you rush to a hospital. Since Laura's story came out in the Boston Globe, Losing Laura, that I wrote, I have heard so many stories, too many stories, from people all over about how confusing hospitals can be. I think they can be by their very nature. And I think they also can be because safety failures can just creep up and become part of the wallpaper that people don't even see anymore. My hope is that this is the first of many Laura's Laws across many states, maybe every state. In closing, I would like to thank our bill sponsors, Senator Pat Jalen, who is here today as well, and Representative Christine Barber, who unfortunately is not here because she's being safe and obeying COVID exposure protocols. I also want to thank their staffs, Vicky Halal, Matt Hartman, and Nora Bent. All of these people could not have been more professional to me or more caring as they held my hand through the long and sometimes frustrating process of trying to get a bill signed into law. Representative Marjorie Decker, I want to thank you for your assistance too. Lastly, there's Laura. What would she say today? Knowing her and how patience was not her strongest suit, probably it's about freaking time this happened. But also, I think she would say, I'm glad I didn't die for no reason. I'm glad that through my death, other people's lives will one day be saved. And you know, that makes me feel pretty great. Thank you again, Governor and Lieutenant Governor.
I'm Pat Jalen. I worked with Peter and Representative Barber and so many others. We're really great. I do bring greetings from Rep. Barber, who is really disturbed not to be here, but she's keeping you all safe, and she's watching online. We're both very grateful to Peter, who has taken the pain and the grief of losing Laura to prevent future tragedies. He's had an education, I would say, in the past 2 years of how a good idea, eloquently expressed with no real opposition, nevertheless is very hard work. And so there, as he mentioned, I won't go into all the people that he mentioned, but all my colleagues who heard his story and their staffs have worked very hard, and it passed on the last night of session. We know that Somerville Hospital isn't the only hospital that had confusing and missing signs and lighting for their emergency entrances. We know that other people have found trouble finding an entrance in a traumatic event, even though they may not have died. For example, we know that when you're experiencing a stroke, minutes count. And if you can't find your way in for even a minute, it will change your future and it will lessen your ability to think, to communicate, and to move. Nobody intentionally made confusing signage and lighting outside hospitals. But if you work there every day, you don't notice the signs and you don't need them to find your way in. Already, Laura's story and Peter's advocacy have made at least 2 hospitals reassess their signage and the monitoring of their entrances. This law will make sure every hospital pays attention to these issues, and it will prevent future tragedies. Thank you, Peter, for your initiative and your persistence. And again, I thank the governor for not only signing the bill, but making it a priority to alert the public and make sure this work continues.
So good afternoon. Let me just start, first of all, by saying that Secretary Mary Lou Sutters at Health and Human Services, Pete, couldn't be here, but wanted you to know that she and her team will move with breakneck speed to implement the requirements and the procedures that are part of this law. And to Nancy and Sam and Amber, I just want to tell you how much we appreciate your being with us today. And we don't do a lot of signing ceremonies in the midst of COVID for a lot of really good reasons. It's hard to put a big group in a room. It's difficult to limit the people who get to come. It's challenging with respect to all the issues that are associated with gatherings generally. But the Lieutenant Governor and I, in this particular case, really wanted to make an exception. And what's ironic about that is when you wrote that story, Pete, and it got published, when we read that story, both of us, we didn't read it as public officials. We read it as a mom and a dad and a son and a daughter, and as a husband and a wife. And we talked about the intensity of the story and the heartbreaking series of things that had to happen, one after another, after another, after another, after another, to take you all the way to the tragic and dreadful end of that tale. And we both thought at the time, there ought to be a law. Now, there are 10,000 bills, plus or minus, that get filed every year in the Massachusetts legislative session, which, as most people know, usually lasts 18 months. 10,000. Now, many of them are refiles, and many of them are done on behalf of constituents, but most of them fall somewhere into the category of there ought to be a law. There's a reason why somebody would choose to file legislation, either on behalf of a constituent or on behalf of their own office, to either pursue a dialogue or a solution or to solve a problem. Somewhere in the vicinity of 500 in a good year make it through that process. It's a tight window. And in this year in particular, given all the issues associated with COVID, and the disruption and the sort of complete change in the way everybody in public life works, that window got a little tighter. But I can't tell you how happy we are that this particular legislation found its way onto our desk and we had an opportunity to sign it and to implement it. And to you all, I would just say, you learn many things in this public life and in this public job that the Lieutenant Governor and Senator Jelen and the other electeds have a chance to benefit from. But one of the biggest things you learn, and you learn it over and over and over again, is the incredible resiliency, power, and strength that regular people have to turn tragedy into opportunity to improve the lives of those who come after them. There are so many pieces of legislation that one way or another are either named after somebody, like this one, or are part of a larger agenda, or a series of engagements, discussions, and ultimately resolutions that come when big groups get together who shared similar terrible, tragic consequences, who decide that this can't keep happening and there has to be change. And it is in some respects one of the truly great characteristics of the people of this state, that folks try to find a way to create something good out of something awful, and have the diligence and the determination and the capacity to articulate that sees it through, which is exactly what happened here. And to you, Pete, I just want to say, God bless. And I know I speak for so many when I say, there but for the grace of God. And to the rest of the DeMarco family and to Amber, thank you so much for being with us. And Amber, I can just tell you, as a Harvard grad from the 1970s, it's a heck of a lot harder to get in there now than it was when I went there. So good luck. And to Senator Jalen, and I know Representative Barber couldn't be with us, thank you so much for carrying the torch on this one and getting it over the goal line. We really appreciate it. And with that, I'd like to start with on-topic questions, particularly if you have them for the Senator or for Pete, and then we can do off-topic. Can you just pursue the end of that question a little bit for me? Well, first of all, we have conversations as an administration almost every day with our colleagues in the hospital and the healthcare community. And I think it's perfectly possible for us and them to work together to make sure that we can start the process of developing what I would describe as the sort of rules of the road with respect to this. And I also anticipate that we'll have willing collaborators who want to help us get this done as quickly as we can. I'm not worried about that. Well, there are a whole series of requirements, most of which have to do with both physical operations, facility capability, and what I would describe as sort of emergency room processes and procedures. And these are all things that I think what we'll try and do is create what I would describe as a uniform but flexible set of standards for people to operate with. And again, this should not take a long time. I get the fact that the emergency's in place and all the rest, but the emergency's not always going to be in place. And if all goes according to plan, and we'll see if it does, I don't think the emergency will be with us beyond the period of time that would be associated with how long it would take people to actually comply. I'm not worried about that.
Nobody who heard the story said no. Some people at one point said, we're really busy with the COVID thing. Can we put it off a little bit? But no one said no. And to pass a bill in one session without a big lobbying budget, it is extraordinary. But the power of an important story that resonates with people, that people can imagine themselves or their loved ones in a similar situation. Pete harnessed that power.
We just signed the bill. But obviously, if this is something Pete's interested in serving on, we'd really appreciate having him involved. Certainly help with urgency. Other questions on the topic? Okay, off topic? So I've talked before about the fact that one of the biggest challenges states face generally with the rollout on this is not a lot of visibility into how far ahead you can look with respect to what you can expect to get from the vaccine program. And that means we're sort of working on a 1-week window into what happens next. We get told on a Tuesday what we're going to get the following week. And the basic message from the federal government has been, well, we don't think you'll get any less, but there really hasn't been anything about any more. And we have about 660,000 people who are in what we call phase 1, which are the folks that we've talked about, the folks who work in healthcare that are COVID facing, residents and staff members at long-term care facilities, home health aides, visiting nurses. You know, the people who are first responders, the people who are really right there on the front line facing COVID, or most heavily at risk for issues associated with getting COVID or being part of a congregate care facility where spread can happen quickly. So 660,000 people in that group, approximately. We've received roughly 420,000 doses so far. We've been told that we can expect to receive somewhere in the general vicinity of 80,000 doses a week, maybe more, depending, which is one of the reasons why we've been sort of focused on making sure we get through this group of 660,000 based on the worst case scenario, which is that we don't get any more doses than we have gotten on a weekly basis so far. And I think we We don't have any visibility into the production line on this. We don't know what Moderna or Pfizer has coming. And I hope one of the things that I and others have expressed to the incoming administration is they really need to find a way to create more clarity and visibility for us around what exactly is coming in the pipeline going forward so that we can create capacity to actually execute on delivering shots in the arms based on some assumption about how much vaccine is going to be available. Well, I guess what I would say is no one at the federal level ever said to me to expect more. Okay, I mean the message we got was you won't get less, and we've all hoped that we would get in fact more, because the message we received was that as production really starts to ramp up, you'll start to see additional vaccines being made available. But it sounds like, at least for the moment, the planning we've been doing, which is to assume we won't get less, is probably about where we should be, at least until the new administration takes office and gets a sense about what that pipeline looks like. We've administered, well, it depends a little on what day it is, and the fact that some of the data associated with that ends up being a little slow to get into the state's database. I think the last set of numbers we saw, roughly 58 to 60% of the doses that have been made available for the non-long-term care community had been administered, and that roughly 40% of the doses for the long-term care community, which remember is 3 visits, okay? So that's part of the reason why their number is lower, has been administered, which makes it net out to around 50%. Pardon me? Well, keep in mind that we're continuing to expand our capacity, and as we move from frontline hospital workers and long-term care residents and staff into home health aides and congregate care, both residents and staff, we are expanding our vaccine rollout capacity. But our goal here is to make sure that those 660,000 people who are part of phase 1 get vaccinated as part of phase 1. And that means 2 doses, not 1. And we need to rely on an assumption from the feds about how much they're going to give us, which at this point is basically you're not going to get more, at least for the time being, than what you got before. So we're just going to work our way down the line and hit those folks as they come up on our list. But we can't be in the business of vaccinating beyond the supply line, I guess is what I would say, or at least beyond our visibility into it. I have no doubt that if we had visibility into how much vaccine we were going to get and when it was going to be here with a fairly high degree of certainty, every state in America, as far as I'm concerned, would have the capacity to deliver that. I am not at all worried about whether or not we will have the capacity on the ground to put shots in the arms to everybody who's eligible based on our criteria, if the federal government gives us a little guidance and a little visibility into how much we can expect with certainty over more than just a week.
Last question.
We are not holding on to any vaccine. Nobody's holding on to any vaccine. We have 660,000 people in phase 1. We've only received roughly 400,000 vaccine shots to begin with. Those 660,000 all need to get vaccinated twice. They need to get dosed twice to be vaccinated. You do the math. That's 1.3 million vaccines doses to actually fully vaccinate phase 1, which is supposed to end sometime in early February. Big. Oh, I think going forward, the combination of pharmacies, healthcare providers, community health centers, and mass vaccination sites, of which we believe we'll have 4 or 5 up around the Commonwealth by the end of this month, starts to look like the type of infrastructure that we'll need to start doing thousands and thousands and thousands of these every day. Yeah. But again, we need to know that the vaccine is actually going to be coming in volumes that are great enough to actually make sure that we can take advantage of that. There are no, I mean, we're obviously in constant contact, and we will be all through the weekend and into next week with the Fusion Center and with our state and local colleagues in law enforcement. At this point in time, there is no specific threat to any physical structure or public asset in Massachusetts. But as we said yesterday, we are sending 500 Guard personnel to Washington, D.C., and they'll probably be there for about a week as part of the national effort to ensure that there's a peaceful and safe transition of power in D.C. And we're also calling up about 500 Guard personnel to basically be on standby in case anything comes up that we need to deal with here in Massachusetts over the next few days.
Thanks, everybody.
I tend not to talk about what the security folks have in mind with respect to how to protect public assets. I don't think it makes sense to sort of lay out your plan. But I will say this: we will have public safety personnel strategically located in various places around the Commonwealth in case anything comes up. Say again? There's the State House has a full-time security expert who oversees security in this building. And that person works closely with the Mass State Police, who have 4 people who are permanently stationed in this building and an operation, an expert in place, as well as the DCR Rangers and the Boston PD. And they have been in constant contact over the course of the past 10 days or so, like every day, more than once a day. And I feel quite confident about the plans and the protocols that they're putting in place.
Thanks, everybody.
I can't speak to the thing because I'm not familiar with it, but there's a lot of very constructive and positive dialogue going on, and there are people whose fundamental role and responsibility is the security of this building and who are experienced in that, who we brought on a couple years ago. Say again? There are no known threats at this point in time here in the Commonwealth. I know less about what might be going on with respect to D.C. Thanks, everybody. And again, I want to thank Peter, and I want to thank your family. Amber, I want to thank you as well. And Senator Jalen, please give our regards to Representative Barber for her work on this as well. I mean, Mike's point about the fact that I know you worked on, the Lieutenant Governor, when she was in the legislature, worked on Melanie's Law, which took at least 2 sessions to get through. Your point's a good one about the fact that this got done. And I think Peter's story, the way he told it, and the significance of the opportunity to make this better probably had a lot to do with why it got done. And thank you all for being here. Have a safe weekend.